That's always a question that I get because that's really up to how the x-rays look and how they're doing. I've had patients where both hips look terrible, but only one bothers them and the other one doesn't. So it's really based off of symptoms. And again, as we've talked about, there are certain factors, environmental injuries, things like that, that might have contributed to one side being degenerative, but the other side not having any problems. So that's something that only you can kind of find out based off of what you see when you see your doctor. We certainly do, and we do them quite frequently for patients that have symptomatic arthritis of both sides or other conditions that might contribute to degenerative changes within their hip joint. But we do that frequently, and patients that have both sides for the right reasons do extremely well. Studies have shown that age really doesn't matter as far as patients' outcomes. Now, certainly as we get older, there are other things that can contribute to our medical status and whether or not we're healthy enough or physically motivated enough to go through a big operation. But some of my happiest patients are my 90-plus-year-old patients that go back and are just as active as some of my 50 or 60-year-old patients. Recovery is a tough one because every patient's different as to how old they are and how active they are going into it. And so that's a very generalized topic, but for the most part, people use something two-handed for a couple of weeks and then maybe down to something single-handed after that. But most people are about 90% recovered by around 3 months or so.